This message is urgent, especially for seniors in the United States, Canada, United Kingdom, and Australia. If you're over the age of 60 and worried about blood clots, you need to know this. Certain fruits and vegetables are not only beneficial, they might literally save your life. Every year, tens of thousands of seniors suffer or even die from complications related to blood clots, and what's terrifying is how many of them had no idea they could have used their diet to drastically reduce their risk. Blood clots are silent killers. They can form without symptoms and then strike suddenly, causing strokes, heart attacks, or pulmonary embolisms. The Centers for Disease Control and Prevention in the United States estimates that about 900,000 people are affected by venous thromboembolism each year, and seniors are the most vulnerable. What's deeply frustrating is how many people believe it's all genetic or inevitable due to aging, when the truth is specific fruits and vegetables can help regulate blood viscosity, prevent platelet clumping, reduce inflammation, and improve arterial health. What's even more alarming is how many seniors in the United States consume diets completely lacking in the exact foods that could keep them alive. The first thing that needs to be addressed is leafy greens, especially spinach, kale, and Swiss chard. These vegetables are rich in vitamin K, and here's where it gets complex. Many doctors warn people on blood thinners like warfarin to avoid vitamin K because it can interfere with the medication. But what most people don't realize is that this advice is about maintaining consistency, not elimination. Studies from both the United States and the United Kingdom have shown that a consistent intake of vitamin K-rich vegetables actually helps stabilize blood clotting responses. What happens to many seniors is they cut these greens out completely and end up with wild fluctuations in their INR levels, which can be deadly. Instead, they should work with a doctor to regularly include these vegetables in a stable amount. The American Heart Association has clearly stated that leafy greens offer critical support for vascular function, reduce inflammation in blood vessels, and contain nitrates that open arteries and improve blood flow. Another category of fruits that cannot be ignored is berries, particularly blueberries, strawberries, and raspberries. These are not just tasty snacks. They are packed with anthocyanins, vitamin C, and fiber, which all contribute to improving endothelial function. Endothelial cells line the inside of blood vessels, and when they are damaged, clot formation skyrockets. In a clinical trial conducted in Canada, elderly patients who added a cup of blueberries to their daily routine showed significant improvements in endothelial repair and platelet function. One woman, age 74, reported that after 6 months of regular berry consumption and dietary changes, her need for blood-thinning medication was reduced under medical supervision. That kind of transformation isn't just medical, it's emotional. It means fewer doctor visits, less anxiety, and a stronger chance at independence. Tomatoes are another essential weapon. Rich in lycopene, which is a powerful antioxidant, tomatoes help prevent the oxidation of LDL cholesterol, a critical step in clot formation. When cholesterol becomes oxidized, it turns sticky and adheres to the artery walls, triggering clotting. Lycopene, especially in cooked tomatoes, helps reduce this risk. Research from the University of Cambridge in the United Kingdom demonstrated that seniors who consumed tomato-based products like sauces and soups experienced measurable improvements in arterial flexibility and platelet aggregation scores. One upper two, other words, their blood moved better, and their risk of forming deadly clots was lowered. And this effect was not minor. It was significant enough that doctors recommended adding cooked tomatoes into the diet at least 4 times a week. Beets, often overlooked, are another super vegetable that plays a direct role in clot prevention. They are high in nitrates, which your body converts into nitric oxide, a natural vasodilator. Nitric oxide relaxes the blood vessels, reducing blood pressure and making it harder for clots to form. In a 2022 study conducted in the United States, elderly individuals consuming beetroot juice daily showed a 12% increase in blood flow efficiency after only 4 weeks. That's the kind of number that could mean the difference between a stroke and another decade of life. Many seniors in Canada and Australia report improved stamina and lower blood pressure when adding roasted beets or beet juice to their diet. The vivid color of beets comes from betalains, which also reduce inflammation and oxidative stress, both major triggers for blood clotting in aging arteries. Avocados, often associated with millennials in the United States, are incredibly beneficial for older adults too. They are rich in monounsaturated fats, which help reduce bad cholesterol and raise good cholesterol. But more importantly, for seniors at risk of clots, avocados are packed with potassium, magnesium, and vitamin E, all nutrients that reduce platelet aggregation and maintain healthy artery walls. A study from the American Journal of Clinical Nutrition showed that elderly individuals who consumed avocados daily had better blood lipid profiles, lower inflammatory markers, and significantly reduced fibrinogen levels. Fibrinogen being one of the proteins that makes blood clot. One man, aged 81 from Florida, shared that eating half an avocado every morning helped stabilize his blood pressure and lowered his risk markers for clotting in just 2 months. The emotional relief of being told that your risk is going down, not up, is immeasurable for seniors constantly bombarded with warnings about strokes and heart attacks. Pomegranates have an extraordinary effect on blood flow. They are loaded with polyphenols, especially punicalagins, which have strong anti-inflammatory and anti-clotting effects. In the United States, clinical trials involving seniors with carotid artery plaque buildup showed that consuming pomegranate juice reduced arterial thickness by up to 30% over 1 year. These findings stunned cardiologists. The idea that a natural fruit could compete with statin drugs and clot-preventing pharmaceuticals is revolutionary. Many seniors in Australia have begun drinking pomegranate juice daily, and several health programs in the United Kingdom now encourage it in senior care facilities. The reduction in platelet activity and blood pressure improvement observed in these patients confirms how potent pomegranates are for protecting aging circulatory systems. Don't underestimate grapes, particularly red and purple ones. They contain resveratrol, a compound also found in red wine, which has been shown to inhibit clot formation. While alcohol consumption has its risks, especially in seniors, grape consumption without the alcohol offers all the benefits without the downsides. Resveratrol helps block platelet aggregation, reduces inflammation, and supports mitochondrial function in endothelial cells. American researchers studying resveratrol supplementation in elderly individuals found significant drops in C-reactive protein and fibrinogen levels after 8 weeks. That means the blood became less prone to clot, the vessels were less inflamed, and the risk of a cardiovascular event dropped. One woman, aged 77 from Michigan, described feeling like her circulation opened up after adding a handful of red grapes to her breakfast every day. Garlic and onions, while not fruits, are vegetables that must be included because of their direct influence on blood viscosity. Both are rich in sulfur compounds, allicin in garlic and quercetin in onions, which prevent blood cells from clumping. This clumping is what leads to thickened blood and clot formation. A major trial from the University of Toronto in Canada showed that seniors consuming garlic extract reduced their platelet aggregation by more than 50% within 3 months. The effect was comparable to low-dose aspirin, but without the gastrointestinal side effects. Many seniors in the United States, worried about stomach bleeding from aspirin, are turning to aged garlic extract and cooked garlic as safer long-term alternatives. The emotional impact of finding a natural solution that feels safer is often overlooked, but incredibly important. The next fruit that deserves serious attention is kiwi. Most seniors wouldn't guess that something so small and sweet could dramatically influence their blood clot risk. But multiple studies conducted in New Zealand and replicated in the United States found that consuming 2 to 3 kiwis daily significantly reduced platelet aggregation and blood triglyceride levels. In one clinical trial, older adults who added kiwi to their diets had blood-thinning effects comparable to aspirin without the negative impact on the gastrointestinal lining. That's an incredibly powerful finding for people in the United States and Canada, where aspirin is often prescribed daily for seniors, despite risks like ulcers and internal bleeding. For someone in their late 70s who already has digestive issues, switching to kiwi might not only reduce clot risk, but also improve quality of life. Some seniors reported less bloating, improved digestion, and greater energy after adding this simple fruit to their breakfast. Citrus fruits, especially oranges, lemons, and grapefruits, play a crucial role in thinning the blood and reducing inflammation. They contain hesperidin, vitamin C, and flavonoids that strengthen blood vessels, lower C-reactive protein, and reduce homocysteine, all of which contribute to clot formation if left unchecked. A study published in the American Journal of Clinical Nutrition found that seniors who consumed citrus fruits daily had a 23% lower risk of stroke over a 10-year period. In warmer regions of the United States, like Florida and California, where citrus fruits are plentiful, doctors have noted better cardiovascular health among elderly patients who maintain high citrus intake. However, grapefruit must be consumed carefully, especially by seniors on medications, because it can interfere with drug metabolism. But under doctor guidance, citrus remains one of the most powerful blood-friendly food groups for older adults. Another vegetable that often gets ignored is celery, but it's rich in phthalides and vitamin K2, both of which improve blood flow and reduce arterial stiffness. What makes celery especially powerful is its diuretic effect. It helps the body release excess sodium and water, which lowers blood pressure and reduces strain on arteries. Seniors in Australia have embraced celery juice as part of morning routines, and reports from caregivers show noticeable reductions in blood pressure spikes and swelling in the legs, often symptoms related to circulatory stress and early clot formation. Celery also contains compounds that reduce the stickiness of blood cells, making it harder for clots to form in narrow or partially blocked arteries. The crispness and water content also make it easy for older adults with chewing problems too. Consume when cooked into soups or lightly steamed. Pineapple, especially fresh and raw, contains bromelain, a natural enzyme that helps break down fibrin, the protein web that forms the structure of blood clots. Bromelain has been researched extensively in the United States, especially in cancer and cardiovascular recovery programs, because of its strong anti-inflammatory and fibrinolytic effects. In one study of elderly veterans undergoing cardiac rehab, those who consumed fresh pineapple daily had lower clot formation markers and faster vascular healing. The enzyme also helps with post-surgical recovery by reducing swelling and promoting circulation. For seniors recovering from hip or knee replacements in the United Kingdom, bromelain-rich diets have been linked to shorter recovery times and lower risk of post-operative clot complications. A nurse in Birmingham shared how several elderly patients who previously struggled with swelling and bruising recovered more smoothly when pineapple was added to their meal plans. One fruit that often surprises people is papaya. This tropical fruit is not only soft and easy for older adults to digest, but it's loaded with vitamin C, folate, and papain, another natural enzyme similar to bromelain that aids in fibrin breakdown and clot prevention. Studies from senior care centers in Canada showed that elderly individuals with limited mobility who consumed papaya regularly experienced reduced leg swelling and better circulation, especially in the lower extremities, where blood pooling and clotting is common in inactive patients. A 68-year-old woman with a history of DVT shared that eating papaya several times a week helped her reduce discomfort in her legs and stopped her from needing compression socks daily. The psychological freedom that comes from such a change, especially for seniors who feel chained to medications and equipment, can't be overstated. Next are cabbage and Brussels sprouts, both of which belong to the cruciferous vegetable family. These vegetables are rich in sulforaphane, which not only detoxifies blood vessels, but also supports liver function, critical for proper blood filtration and clot regulation. Sulforaphane also influences how the body produces enzymes that thin the blood naturally. A study conducted in the United Kingdom found that older adults who ate cabbage or Brussels sprouts 4 times per week had better fibrin degradation activity, meaning their bodies were better at breaking down early clot formations before they became dangerous. These foods are especially important for seniors with poor liver health or taking multiple medications, which can tax the liver's detox functions. Many seniors in Canada now include steamed Brussels sprouts in their dinner plates to keep their arteries clean and their blood less sticky. Turmeric, while technically a spice, should be included because of its high content of curcumin, which acts as a natural anticoagulant. Seniors in the United States, especially those following integrative medicine programs, are being encouraged to consume turmeric with black pepper to enhance absorption, either in tea, capsule form, or sprinkled into food. Curcumin has been shown in multiple studies to reduce thromboxane, a molecule that signals the body to form clots. In one large-scale study involving seniors over 65, curcumin supplementation for 12 weeks lowered their clotting factor activity and improved arterial elasticity. A 75-year-old retired teacher in Oregon who began using turmeric lattes reported improved circulation and less coldness in her hands and feet during winter, which had been early signs of poor peripheral blood flow and clot risk. When a senior starts to feel warmth and vitality returning to their extremities, it can feel like a second chance at life. Cucumbers may look boring, but they are incredibly hydrating, low in calories, and high in silica, potassium, and vitamin K. Their water content helps maintain plasma volume, keeping blood from becoming too concentrated, a major cause of clot formation in older adults who are often dehydrated. In many parts of Australia, health campaigns have been targeting seniors specifically to increase their cucumber and fluid intake to avoid dehydration-induced clotting, especially during the summer heat. A silent but dangerous issue in older adults is reduced thirst sensation, meaning they don't realize when they're not drinking enough, which increases blood thickness. Adding cucumber slices to water or meals helps keep blood volume stable, supporting clot prevention without the use of diuretics or artificial medications. Apples, especially when eaten with the peel, contain quercetin, a flavonoid with blood-thinning, anti-inflammatory, and antioxidant effects. Multiple studies in the United States have linked daily apple consumption with lower levels of oxidized LDL cholesterol and better endothelial function in seniors. What makes apples unique is their effect on gut bacteria, which influences how the liver and immune system regulate blood components. In a long-term study involving elderly participants in Canada, those who consumed at least 1 apple per day had 35% fewer blood clot-related events over a 5-year span. Apples are accessible, portable, and easy to eat for seniors with limited mobility or dental issues, making them one of the most practical and effective daily additions to reduce clotting risk. Another overlooked but critical food is asparagus. This green vegetable contains glutathione, fiber, and vitamin B6, all of which support healthy blood vessels and reduce homocysteine, a compound that promotes clot formation when elevated. Seniors in the United Kingdom who consumed asparagus regularly showed reduced blood pressure and better arterial flexibility, as reported in NHS dietary intervention programs. A caregiver at a senior center in Leeds shared how seniors who began consuming asparagus soup 3 times a week showed fewer incidents of swollen legs, a common warning sign of poor circulation and potential clot buildup. The softness of asparagus after cooking makes it ideal for older adults with chewing or digestion issues. Mangoes, rich in vitamin C, vitamin A, and natural enzymes, support vascular repair and inflammation reduction. They also contain mangiferin, a bioactive compound that has been shown to protect endothelial cells from oxidative damage, which is a trigger for clot formation. Seniors in Florida and Texas have access to fresh mangoes year-round, and physicians in those states often recommend them as part of cardiovascular diets for elderly patients. One 70-year-old patient with a prior pulmonary embolism noted feeling lighter and more energized after introducing mango to her daily smoothie, reporting fewer instances of calf tightness, a subtle but dangerous signal of early clot development. These fruits and vegetables are not just healthy, they are strategic. For seniors in the United States, United Kingdom, Canada, and Australia, every food choice matters more than ever. Blood clots are deadly, and often they don't come with warnings. But your plate could become your most powerful defense.